Good evening and good morning to colleagues from the media. I convened an emergency committee under the international health regulations to gather advice on the severity of the health threat associated with the continuing spread of Zika virus disease in Latin America and the Caribbean. The committee met today by teleconference. In assessing the level of threat, the 18 experts and advisors looked in particular at the strong association in time and in space between infection with the Zika virus and a rise in detected cases of congenital malformations and neurological complications. The experts agree that a causal relationship between the Zika infection during pregnancy and microcephaly is strongly suspected, though not yet scientifically proven. All agree on the urgent need to coordinate international efforts to investigate and understand this relationship better. The experts also consider patterns of recent spread and the broad geographical distribution of mosquito species that can transmit the virus. The lack of vaccines and rapid and reliable diagnostic tests, and the absence of population immunity in newly affected countries were cited as further causes for concern. After a review of the evidence, the committee advised that the clusters of microcephaly and other neurological complications constitute an extraordinary event and a public health threat to other parts of the world. In their view, a coordinated international response is needed to minimize the threat in affected countries and reduce the risk of further international spread. I am now declaring that the recent cluster of microcephaly and other neurological abnormalities reported in Latin America, following a similar cluster of French Polynesia in 2014, constitutes a public health emergency of international concern. As a precautionary measure, and because of the association, a coordinated international response is needed to improve surveillance, the detection of infections, congenital malformations, the detection of and neurological complications, to intensify the control of mosquito populations, and to expedite the development of diagnostic tests and vaccines to protect people at risk, especially during pregnancy. The committee found no public health justification for restrictions on travel or trade to prevent the spread of Zika virus. At present, the most important protective measures are the control of mosquito populations and the prevention of mosquito bites in at-risk individuals, especially pregnant women. So thank you for that. And now let me invite the chair of the emergency committee, Professor David Heymann, to continue.
Thanks very much, Director General. The committee had a very interesting discussion this afternoon because we had very good input from countries that are affected with Zika outbreaks and also with these clusters of microcephaly and disorders and neurological disorders, and also had a very good group of advisors. And it was a very difficult decision to discern between what is a public health emergency of international concern and what should be precautionary measures because of possible relation between Zika and these clusters. But in the end, as the Director General said, the FEB was called, the Public Health Emergency of International Concern was called regarding the clusters of microcephaly and neurological disorders, and there were two major recommendations. These were surveillance for microcephaly and other neurological disorders needs to be standardized, and particularly in areas where Zika virus transmission is occurring. And at the same time, there needed to be intensified research of new clusters of microcephaly and neurological disorders, and to determine in case control and other study methodologies whether there is a causative link to Zika virus and other factors. So that is the fake. The fake has to do with proving that these clusters are or are not linked to the Zika virus. But as the Director General said, there were a whole series of precautionary measures that were made because there is an association in time and place, and possibly that association will be proven. And when it's proven, we want to be sure that those measures have been taken that will, if it is proven, have been beneficial. And they therefore involve a whole series of other recommendations, which are just good, plain public health practice. Measures regarding vector control, regarding surveillance, and then long-term measures which would regard such things as making sure that there are discussions going on about the possibility of providing research and development for vaccines and for other types of goods which would be necessary to control Zika virus should it shown to be a causative factor for these links.
The opinions of the experts is that even the clusters of microcephaly alone is sufficient to declare a FEB because of its heavy burden on parents, on mothers, and on the community and society. There is urgent need to do a lot more work and establish whether or not there is a definitive association between the Zika virus infection. But having said that, the information presented by the countries present, including Brazil, US, El Salvador, and also France, representing the areas and territories in Polynesia. The evidence is growing and it's getting strong, and so I accepted even on the microcephaly alone, it is sufficient to call a FEB, so that we need coordinated international response to make sure that we get to the bottom of this. But of course, the mosquito that spread the Zika virus is ubiquitous in so many countries, and countries that are experiencing dengue, yellow fever, as well as chikungunya. It is incumbent upon us also to work with those countries who are reporting outbreaks already, to pay attention and then to follow whether closely, of course, the public health people and the clinical experts, doctors, either in primary health care or in hospitals, to make a very important linkage, to be on the alert for unusual events. So there are two meanings to me. First and foremost, the big concern about microcephaly and the heavy burden on families, on women, and so on. But taking precautionary measures to introduce the whole host of measures can reduce the risk if indeed the science and the linkage between Zika and microcephaly is established. Can you imagine if we do not do all this work now and wait until the scientific evidence comes out? Then people will say that, why don't you take action? Because the mosquito is ubiquitous. Many measures, preventive measures, like vector control and appropriate personal protection, like avoidance by mosquito bites, those are simple, effective measures that we should be taken. And it is also good for other public health conditions like dengue and others.